So my name is Leo Martinez. I'm an assistant professor in the Department of Epidemiology. And my work focuses on the epidemiology of tuberculosis, especially in incarcerated populations, and especially in South and Central America and across the Americas. And I think when we think of infectious diseases generally, right now we're thinking a lot of COVID, right? But TB is actually the #1 infectious disease killer now globally. But it's often neglected, especially historically. And generally, I learned really quickly in this field, TB in prisons is a field that has been very historically neglected, not focused on. And what happens is there's sort of a domino effect that can happen. If a field is neglected, there's often big data gaps in that field. There's a lack of information on what type of interventions we should apply to this population that is at high risk. It's difficult to advocate for health policy, and then it's difficult to advocate for this population because there's not the rest of the things in this list. And so a lot of my research is trying to hit different areas of this domino effect to try to create more advocacy for this group. So so this project was a project done with the Pan American Health Organization and with country level officials throughout Central and South America to try to provide new information about the incarceration epidemic in Central and South America, and also how the TB epidemic is impacted by mass incarceration. So this is the number of incarcerated people in South America on the left and in Central America on the right over time. You can see here, this is from 2000 to 2017. And you can see that it has continuously increased for the past 2 decades. In both regions, it's not only doubled or tripled the amount of incarcerated people. And this is not due to an increasing population generally. This is also, the incarceration rate is also increased over time. And so as an epidemiologist that focuses on a respiratory disease that is very common in prisons, this is pretty concerning. And so we wanted to look at, in these countries, what is the TB epidemic? What is happening with the TB epidemic in these countries? So on the left, you can see different countries, and this is the increased risk of TB in that country compared to outside of prisons. So in some countries, the increased risk of TB is 25, 50, 75 times higher if you're in a prison than if you're outside of a prison. So it really suggests that these levels of mass incarceration are really creating a haven for TB in these prisons. On the right, you can see this is the proportion of all TB that occurs in a country that occurs in prisons. So you can see on the left, 5, 10, 15%, 20%. This is the proportion of TB that occurs in prisons throughout the entire country. And you can see that this has been going up over time over the past decade and a half or so. It is now around 15% in many of these countries. And this is a population that represents less than 1% of the entire population. So the fact that they're contributing 15, 20% of the TB in that country is pretty concerning. I think the other part that I really enjoyed about this project is that we collaborated with the Pan American Health Organization. So it allowed us to integrate some of this research directly into policy because they're a policy organization. So this led to a workshop with country level officials to discuss these results, which led to writing regional guidelines on TB in prisons. And then it also led to mandated reporting from countries about how much TB was occurring in prisons throughout the region. So this was a huge positive part of this project. Thank you.